Hi, my name's Phil. I like talking about politics. In this video, I'd like to touch on another way in which the Corona and Brexit crises are going to collide in a way which will almost certainly mean facing a delay in the ability to vaccinate against the virus in the UK. But first, if you'd like to be notified of daily news and politics, then please click the subscribe button and then the bell notification icon. So, in pursuit of a hardline attitude towards Brexit, none of which was campaigned for in the 2016 referendum, Boris Johnson is pulling the UK out of all forms of European cooperation, even on matters that need have no impact on the Brexit outcome. One of these is the European Medicines Agency. Now, this organisation allows for the fast tracking of medicine monitoring during times of pandemic to be able to get things to people when they need it. It essentially enables us to get those treatments and vaccines more quickly than would otherwise have been the case without compromising safety. It's not about like, oh yeah, we won't run trials on it, we'll just give it to people and see what happens. Now, we've already left the EU's emergency bulk buying system for vaccines and medicines, and Johnson has also banned our Health Secretary Matt Hancock from engaging with his counterparts in Europe, none of which was needed while still in the transition period. Frankly, none of which was needed at any time at all. But what it does mean is that the UK is out of the loop. We're not even able to develop treatments or tests ourselves. For example, there was a team in Newcastle developing a new way of testing the virus really quickly, but it had to be developed elsewhere. They've had to carry on developing it in the EU, as we don't have the regulatory framework to do so in Britain, at least not in a timely manner. And what this means is that when a vaccine is developed, and it doesn't matter where it's developed, once it's developed, the UK will have to wait longer for it and pay more. The UK government wanted Britain to be treated as an independent country, and so it shall. What this means is, for our fellow UK citizens, when a treatment eventually becomes available, thinking about a vaccine in particular here, our government, in an act of pure spite, it's nothing else than that, will have ensured that we will have more delayed and a more restricted access to it than should be the case. And it isn't even a case of how Brexit, which was supposed to empower Britain, is actually making us weaker. This has got nothing to do with Brexit. There are plenty of examples of how Brexit is actually making us weaker. This is not one of them. Brexit could have just been about trade. It could have been just a dumb idea that was reversed with another referendum, though that ship seems to have sailed for now. What it didn't have to be was about cooperation on matters of mutual benefit. No one campaigned for that at any point. Cooperation on security or healthcare matters have no impact on sovereignty at all, real or imagined. So this isn't Brexit making us weaker. This is a quite insane government making us weaker for no easily explained reason. So what will happen next year when we're out of the transition period and when we are expecting a vaccine to be ready? It's likely to take about a year. Someone develops a vaccine and it needs approval before it can be given out. So according to experts, there are two things that are going to cause delays for those of us in Britain. The first is that the UK is refusing to cooperate with the EU. That means we can't use the EU's regulatory systems. We're going to have to come up with our own. That will take time. We don't have them right now. So even if this is prioritised over the hundreds of other regulatory systems that we're suddenly going to have to develop overnight and for which there is scant groundwork at the moment, that means that we are not going to have something in place in time for this. And what we do have in place is going to have an awful lot of problems because it'll have just been thrown together very, very quickly by a government that does not think in the long term. The second reason is, so let's say you're a pharmaceutical company and you have just developed a vaccine or some other treatment, and you need to get approval before you can offer it for sale. So would you choose to apply to the EU first with 500 million customers and a system for fast tracking approval? Or the UK, which has just thrown together a regulatory framework which is experiencing many teething problems and represents only 66 million customers? It's a tricky one, isn't it? And even when we do get access to the vaccine, which will have taken much longer, it will cost more as well. It will be a simple case of economies of scale. The EU countries are going to club together and buy much more collectively, so they'll get a greater discount than the UK alone can obtain. Again, this isn't me just spitballing. This is how experts say the current system operates in practice. And given that despite the promises in the budget, the NHS are not being properly funded, that means that we will not be rolling out the vaccination programme very quickly at all, even once our regulatory systems have given it approval. And for those thinking that the budget has given the NHS a load more money, I mean, that's what they promised. They said the NHS is going to have anything it wants. I would say this, where is this money then? It's all right saying there's money there. Where is it? In the UK, if you have symptoms for coronavirus, you can't get tested for it. Unless it's so bad that you've been admitted to hospital, you've got pneumonia or something like that, it's really bad, then they'll test you. But if you're just developing symptoms, you cannot be tested. You're just told to self-isolate. In other countries, you would be tested. Maybe not the United States. So anyway, hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.